Functional vision head impulse test. According to an audiometrist, the functional head impulse test is an objective vestibular assessment used to evaluate the functional performance. The vestibulo-ocular reflex (VOR), unlike the conventional video head impulse test (vHIT), which measures eye movement and viewer gain. If vHIT evaluates whether a patient can maintain clear vision during rapid passive head movements. It measures the patient's ability to recognize visual targets while the head is moving, providing valuable information about functional vision and vestibular performance. Purpose: the main purpose of functional vision head impulse test is to evaluate the patient's visual performance during rapid head movements. It helps clinicians determine whether the vestibular system is functioning adequately to stabilize vision during daily activities. Principle: during rapid head movement, the vestibulo-ocular reflex automatically moves the eyes in the opposite direction of the head movement to keep the image stable on the retina. If the vestibular system is impaired, retinal slip occurs, resulting in blurred vision or oscillopsia. The fvHIT evaluates this functional visual ability rather than only measuring eye movement. What if vHIT measures? The functional vision head impulse test measures functional visual acuity during head impulses, percentage of correctly identified visual targets, vestibulo-ocular reflex performance during head movements. Functional impairment of each semicircular canal. Patient progress during vestibular rehabilitation, head acceleration range. The fvHIT objectively measures performance during head acceleration between 1000 and 7000 degrees per second squares. Planes tested. The functional vision head impulse test evaluates the vestibulo-ocular reflex in three semicircular canal planes: lateral, horizontal, LARP, left anterior, right posterior; RALP, right anterior, left posterior. Clinical uses: diagnosis of unilateral vestibular hypofunction, diagnosis of bilateral vestibular hypofunction, assessment of dizziness and imbalance, evaluation of oscillopsia, monitoring vestibular rehabilitation, assessment of treatment outcome. Advantages: quick and non-invasive examination, objective assessment, functional evaluation of vision, can be repeated to monitor recovery, useful in vestibular rehabilitation. Role of an audiometrist: an audiometrist performs the test by providing standardized head impulses, ensuring correct diagnosing vestibular disorders. The audiometrist also uses fvHIT findings to monitor patient improvement during vestibular rehabilitation. Difference between fvHIT and vHIT: fvHIT evaluates functional visual performance during head movements, whereas vHIT evaluates eye movement and vestibulo-ocular reflex gain. Both tests complement each other and provide comprehensive vestibular assessment. Conclusion: the functional vision head impulse test is an important functional vestibular assessment that objectively evaluates the patient's ability to maintain visual clarity during rapid head movements. It provides valuable information for diagnosis, rehabilitation, and follow up of vestibular disorders. ফাংশনাল ভিশন এড ইম্পালস টেস্ট হলো একটি আধুনিক ও অবজেক্টিভ ভেস্টিবুলার পরীক্ষা যার মাধ্যমে দ্রুত মাথা নাড়ানোর সময় রোগী কতটা পরিষ্কারভাবে দেখতে পারেন তা মূল্যায়ন করা হয়। এই পরীক্ষা ভেস্টিবুলো অকুলার রিফ্লেক্স এর কার্যকারিতা বাস্তব অবস্থায় মূল্যায়ন করে। উদ্দেশ্য: দ্রুত মাথা নাড়ানোর সময় রোগীর দৃষ্টিশক্তি কতটা স্থির থাকে তা নির্ণয় করা হয়। ভেস্টিবুলার রোগ শনাক্ত করতে সহায়তা করা, ভেস্টিবুলার পুনর্বাসনের অগ্রগতি পর্যবেক্ষণ করা, চিকিৎসার ফলাফল মূল্যায়ন করা। কাজ করার মূলনীতি: স্বাভাবিক অবস্থায় মাথা দ্রুত নড়লে চোখ স্বয়ংক্রিয়ভাবে বিপরীত দিকে নড়ে।